Have you ever wondered what the signs of colon cancer are? Well, today, we're going to dive deep into this important topic. Early detection of colon cancer can make a significant difference in treatment outcomes. This video will guide you through the critical symptoms, providing you with knowledge that could potentially save a life. From unexplained weight loss to persistent abdominal discomfort, we'll cover the signs that you should never brush off. So buckle up and join us as we delve into the critical colon cancer symptoms you should never ignore. First off, we have unexplained weight loss. Now this symptom can be a bit tricky to understand. Most people would be overjoyed to shed a few pounds without having to break a sweat. But when it comes to weight loss that is sudden and unexplained, it's crucial to pay attention. Colon cancer, like many other types of cancer, can cause weight loss. This isn't always due to a conscious change in diet or an uptick in exercise. Instead, it can be an indirect result of the disease. As cancer cells grow, they can take up a lot of the body's energy. This can lead to weight loss, even if you're eating the same amount of food as before. The tumor could also be causing a blockage in the colon, making it hard for food to pass through. This leads to a decrease in the amount of nutrients your body can absorb, which can also result in weight loss. It's also important to note that the weight loss associated with colon cancer isn't always dramatic. Sometimes it's a slow, steady decrease that might not even be noticeable at first. But if you find that you're losing weight without trying and you can't pinpoint a reason why, it's worth getting checked out. Unexplained weight loss can also be caused by other health issues, not just colon cancer. Conditions like diabetes, hyperthyroidism, or even depression can lead to weight loss. That's why it's essential not to jump to conclusions. If you're experiencing unexplained weight loss, it doesn't automatically mean you have colon cancer. But it does mean that something in your body might not be working as it should, and it's important to find out what. Seeking medical advice is always the best course of action. A healthcare professional can help identify the cause of your weight loss and guide you through the necessary steps to address it. So, remember, unexplained weight loss can be a sign of something more serious, like colon cancer. It's one of those symptoms that should never be ignored. It's not about causing panic, but rather about promoting awareness and encouraging timely medical intervention. Because when it comes to your health, every moment counts. Another symptom to watch out for is a persistent change in bowel habits. Now, what exactly does this mean? Let's break it down. When we talk about bowel habits, we're referring to the routine or pattern of your bowel movements. Everyone has their unique rhythm, and it's essential to be in tune with your own. So, a persistent change in these habits can be a sign that something is amiss. One of the most common changes people notice is constipation. If you're finding it hard to pass stool or you're going less often than you usually do, this could be a cause for concern. But remember, occasional constipation can happen to anyone and is often linked to diet and hydration. It's the persistence of this symptom that's the red flag. On the flip side, diarrhea that sticks around longer than a few days is another change to look out for. We all know how unpleasant this can be, but if it's happening frequently, it's not something you should dismiss. Changes in stool consistency are worth noting too. If you notice your stool is thinner than usual, or it's loose and watery over an extended period, it could be a sign of trouble. Again, the key word here is persistent. Everyone has off days, but if these changes stick around, it's time to take action. But why are these changes a cause for concern? Well, colon cancer can disrupt the normal function of the colon, leading to these symptoms. For instance, a tumor might partially block the colon, leading to constipation or changes in stool size. Or it could cause inflammation, leading to diarrhea. The bottom line is, your body has a way of signaling when something's not right. And while it's all too easy to dismiss changes in bowel habits as just a bad day or a dodgy meal, if they're persistent, it's crucial to listen to what your body is telling you. Don't ignore persistent changes in your bowel habits. It could be a warning sign. So take note, and if you notice any persistent changes, reach out to a healthcare professional. It's always better to be safe and to catch potential issues early on. Next, we have blood in stool or rectal bleeding. This symptom can indeed be alarming, and rightly so, as it can be an indication of colon cancer. It's not something to be brushed aside or ignored. This is your body sending you a distress signal, and it's crucial that you pay attention. Now let's delve a little deeper into this. Blood in your stool doesn't always appear as bright red streaks. Sometimes it may be more subtle, like a dark coloration or even causing your stool to appear black. This is due to the blood being digested and broken down. In other cases, the bleeding might be more obvious, with bright red blood that can be seen on toilet paper after wiping. Another point to note is that blood in your stool doesn't always mean you have colon cancer. There are other conditions that can cause this symptom as well, such as hemorrhoids or anal fissures. Hemorrhoids, for instance, are swollen blood vessels in your rectum or anus that can bleed during bowel movements. However, the blood from hemorrhoids is usually bright red and might be seen on the toilet paper after wiping, but not mixed in with your stool. On the other hand, if the blood is mixed with your stool, it could indicate a more serious condition like colon cancer. This is because the bleeding in colon cancer usually occurs from polyps or tumors that are higher up in the bowel, which gives the blood time to mix with the stool as it travels through your digestive tract. It's also important to remember that rectal bleeding can occur without any visible blood in your stool. This might present as a feeling of needing to have a bowel movement that doesn't go away, even after going to the bathroom. If you notice blood in your stool or rectal bleeding, it could be a sign of colon cancer, and you should consult a doctor immediately. Early detection is key, and it could make a world of difference in your treatment and prognosis. Persistent abdominal discomfort is another symptom you should not ignore. Now, we're not talking about the occasional stomachache from eating too much pizza on a Friday night. We're referring to a discomfort that lingers, that stays with you, and seems to have set up camp in your abdomen. So what does this feel like? It's a bit like a permanent cramp, a persistent bloating, or a constant feeling of fullness, even when you haven't eaten much. You might find yourself doubled over in pain, or you might just feel a vague discomfort that isn't quite pain but is definitely not normal. It's a bit subjective, as it can vary from person to person. Now, why is this a symptom of colon cancer? Well, as the tumor grows in your colon, it starts to press against the walls of your abdomen, causing discomfort. It can also cause blockages that lead to a buildup of gas and stool, which can further increase the discomfort. However, persistent abdominal discomfort can easily be mistaken for other conditions. This is where things get a little tricky. It's a common symptom for a lot of other ailments as well, like irritable bowel syndrome, gastritis, or even just stress. Because of this, it can often be dismissed as something less serious, leading to a delay in diagnosis. But here's the thing. If you're experiencing persistent abdominal discomfort, it's crucial to get it checked out. Even if it turns out to be something else, it's better to be safe than sorry. And if it is colon cancer, catching it early can make a world of difference in treatment and prognosis. So, don't brush it off. Don't just pop an antacid and hope it goes away. Be proactive about your health. Listen to your body and what it's trying to tell you. Remember, persistent abdominal discomfort should not be overlooked. It's not about being paranoid, it's about being aware and taking care of your health. Because at the end of the day, your health is your wealth. Feeling unusually weak or fatigued, it could be a sign of colon cancer. Now, that's not to say that every bout of tiredness is a cause for alarm. We all have those days when we feel drained. But if you're experiencing persistent, unexplained weakness or fatigue, it's worth paying attention to. Why does colon cancer cause these symptoms? The answer lies in how this disease affects your body. Colon cancer often leads to internal bleeding, which can go unnoticed for a long time. This slow, chronic loss of blood can result in anemia, a condition characterized by a lack of enough healthy red blood cells to carry adequate oxygen to your body's tissues. And when your tissues aren't getting enough oxygen, you can feel tired or weak. This fatigue isn't your run-of-the-mill tiredness. It's more than just feeling wiped out after a long day. It's a deep-seated exhaustion that doesn't go away with rest. It's the kind of fatigue that can make it tough to get out of bed in the morning, that can make everyday tasks feel like climbing a mountain. Moreover, colon cancer can also lead to a loss of appetite, which in turn can result in nutritional deficiencies. These deficiencies can further exacerbate feelings of weakness or fatigue. The impact on daily life can be significant. Persistent fatigue can affect your ability to work, to engage in social activities, and to enjoy life. It can affect your mood and mental health. It can make it harder to cope with the challenges of everyday life. This is why it's so crucial not to write off these symptoms. If you're feeling persistently weak or fatigued, it's essential to seek medical advice. Your doctor can help identify the underlying cause and guide you on the necessary steps to address it. Remember, early detection is key in dealing with any form of cancer, including colon cancer. Don't write off persistent weakness or fatigue. It could be a symptom of something more serious. Let's quickly recap the critical symptoms of colon cancer that you should never ignore. Throughout our discussion, we've delved into 5 key symptoms that may indicate the presence of colon cancer. Each one is a potential red flag, and their persistence should be taken seriously. This isn't about causing alarm, but about empowering you with the knowledge to recognize early signs, as early detection can make a significant difference in treatment outcomes. Our first point of discussion was unexplained weight loss. If you're shedding pounds without any changes to your diet or exercise routine, it's a cause for concern. This could be a sign that your body is working overtime to fight off cancer cells. Next, we talked about persistent changes in bowel habits. This doesn't just refer to the frequency of your bowel movements, but also to their consistency. If you notice any prolonged changes, it's crucial to consult with a healthcare professional. The third symptom to watch out for is blood in your stool or rectal bleeding. While it can be a sign of less serious conditions like hemorrhoids, it's also a common symptom of colon cancer. Don't dismiss it, especially if it's recurring. We also highlighted persistent abdominal discomfort. This can manifest as cramps, gas, or pain that doesn't seem to go away. It's easy to blame these symptoms on something you ate, but if they persist, it's a clear sign that something is not right. Finally, we discussed weakness or fatigue. While it's normal to feel tired after a long day, persistent fatigue that doesn't improve with rest is a cause for concern. It could be your body's way of telling you that something is amiss. In summary, these symptoms, unexplained weight loss, persistent changes in bowel habits, blood in stool, persistent abdominal discomfort, and ongoing weakness or fatigue, may all be signs of colon cancer. However, these symptoms can also be associated with many other health conditions. The key is to not ignore them. If you experience any of these symptoms persistently, it's essential to seek medical advice. Remember, early detection plays a critical role in successfully treating colon cancer. Don't let fear or embarrassment prevent you from seeking help. It's important to listen to your body and take action when something seems off. Remember, your health is important. Don't ignore these critical colon cancer symptoms.